The next part of today's session focuses on what this all means for us all here today. So apart from showcasing Compass work and our researchers, we wanted to bring everybody here today to talk about potential opportunities for research and collaboration before we then have a discussion about how we can facilitate that engagement. And that's ultimately because we want to do better research. We want our research to be as good as it can be, and we want to make sure it's as useful as it can be, and that all potential stakeholders are involved in what we do. So we're always open to, in terms of what we can do with community groups. Steph has mentioned a couple of these already, but we are always open to discussing new projects and developing funding applications. We are a small team, but we have a broad range of interests, and we love data, ultimately. We love getting our hands on numbers, and we love doing research. So we're always interested to talk to communities about research projects they would like to develop. And as I've said, we have lots of existing data. All of the projects we work on mean that we have data sitting in the IDI or sitting at Compass that could be really useful for community groups. That might be that we can provide specific data that community groups can use for their policy documents to develop their strategies for things like pharmac applications if they're involved with a health condition that has medicines that need funding, or for other funding applications, and just for kind of advocacy to support the communities that groups represent. We can work on, bespoke outputs. So over on the table over there, some policy briefs that we've done for the Life Course project. Offer and I are very keen to do some kind of translated versions for, well, we've talked about Tongan, hopefully other Pacific nations, because I have the data that I can look at specific groups, and so we can gear the data towards those groups. And we can do that. We could do that for some of the other health conditions. We're always, happy to make use of that data we have and work with community groups to make that data or those findings accessible as much as possible. And we're available for consultation to actually undertake work. So if people have an IDI project that they need somebody to do for them, or a survey that they need somebody to run, then that's what we're there to do. We're always keen to work with other people and groups. What, in addition to the activities I mentioned on the previous slide, we recognise community groups can be a really valuable resource for us, especially when we're developing new projects, but also when we're carrying out existing projects, as well as when we try and disseminate our findings. So that might be providing expert community input, helping with recruitment. So if we're carrying out a survey, or if we're doing some qualitative work, which we sometimes do, although we love the numbers, Offer in particular is amazing at working in that qualitative space. We know that community groups are often in contact with a large range of other stakeholders, so policymakers, clinicians, for example, and we are always on the lookout for students to help with research activities. So if anybody does know any students looking for projects, please get in touch with us. We hold academic seminars that community groups would be welcome to speak at, and we would love to come and talk to your communities about our research. Steph mentioned some of these earlier, but as an academic research centre, we are fortunate that we have access to a broad range of resources that help with that research process and enable high quality research. So we have ourselves and our expertise, and as part of the University of Auckland, we have access to that research infrastructure. So things like the IDI, we have a data lab that we can access as part of the university. We have data collection and data analysis software that is made available to us. We have access to those funding streams that often need a university to apply for, and some of those processes that are required for research, like ethics applications, which we are very successful at in general, and peer review if you have a piece of work that needs reviewing, that you need some expert research advice on. That said, we are aware there are challenges of working within the academic setting for community collaboration. Funding is an issue for all of us here, I'm sure. And as I've said, we are a small team. Applying for funding through the university is a time-consuming process. You often have to have things ready a long way before the official submission date for grant application, and it can take a long time in terms of when you actually see the funding from when you submit the application. As academics, we have professional and institutional goals that we need to meet, and that can conflict with other needs, especially when you're an early career researcher. I'm very lucky. I'm at a stage where I don't mind where I publish or what reports I put out. But when you're in the early part of your career, you really do have to publish or peril, because that's what your career is based on. And it's hard to get universities to recognise the importance of community work, the importance of outputs that are important for community groups. We're very aware that community groups are short on people and short on funding. So we want to make sure that we're flexible in terms of the amount of involvement that we're asking for. I know that's something that Natalia is always worried about. What should I be asking people to do? And I've said the answer is just to be as flexible as you can. Be very clear about expectations and find out what community groups would like. Do they need compensation for their time? Are they happy to provide input for no charge? And we know that academic engagement with communities can feel tokenistic, and we need to work on ways to make sure that doesn't happen, that people feel valued and engaged by us. We also know it can be difficult to understand the research process and outputs, especially with the terminology and jargon that we've probably bandied around today. And so we want to make sure that the outputs we're producing in the most part are accessible, can be read by community, but also we'll need you to tell us when we're just talking with using words that nobody can understand except us somehow. We also know that sustaining long-term engagement can be difficult. So I've listed just a few examples here. I'm really keen to hear from everyone in the discussion about your perceptions of this. So gonna have a quick chat with Lauren Donnan in a moment, who is a researcher but also works with the community groups. So she's going to tell us about her experience of working with Campus. So yeah, do you want to introduce yourself, Lauren, and tell us what it was like working with us?
Yeah, absolutely. Kia ora, my name is Lauren Donnan. I am talking today as a past board member of what was Camp Unity and has become Unseen Heroes. So for a bit of context, Camp Unity began in response to the need of young carers, which are our tamariki rangatahi, who support loved ones with a mental illness, disability, chronic illness, etc. And I did my doctoral studies in the experiences of young carers in Aotearoa, and that led me to connect with Terina, the wonderful founder of Camp Unity. Began providing camps for young carers to bring them together to address the issues they were facing in terms of staying in education while carrying out their care roles and the emotions that go with that. And that grew and expanded to be much more than a camp, and they engage with young carers on a much longer basis, and they're alongside them along their journey as they stay in education, go on into the workforce. So just an incredible organisation. So just a huge shout out to Unseen Heroes there. So in my capacity now, I work at Mates in Construction, which is a suicide prevention charity. And so still in that research policy advisory advocacy space. And a big part of what I do is connecting research to grassroots, real world outcomes. And that's where Compass comes into play. So in the young carer space, the biggest challenge is that it's a very, very hidden population in New Zealand, and we don't know a lot about young carers, especially in terms of how many young carers there are. And that makes it really difficult, one, to engage in research with young carers, because it's very hard to get participants when the participants themselves don't know they are young carers. So that's a huge challenge. But it's also very difficult to get that connection between the research, and then the systemic big change you're aiming to achieve with the community in terms of shifting the dial on policy to make sure young carers are included in the carer strategy, that any action plan agenda items for young carers are followed through on. If you don't have really concrete data to back up what you're trying to show, and Australia and the UK have data, but it's really important we hear from young carers in Aotearoa about their own experiences and that we lean on our data within Aotearoa. So I would like to say that I shine in the qualitative space in terms of working with communities, hearing their voices, walking alongside them in advocacy and research. When it comes to the big quantitative data, that's probably not my strong point. So Compass has been incredible in terms of being able to provide the quantitative data. So starting to understand how many young carers do we have in Aotearoa according to the census caring questions. And not only that, but who are our young carers? What's the gender of our young carers? What kind of ages and ethnicities? Who are they caring for, and how many people are they caring for? And beyond that, looking at the regions that our young carers are caring in. And that data, alongside the qualitative lived experience voices of young carers, makes this powerhouse combination where you're able to do evidence briefs to present to the ministry, where you're able to put your best foot forward in terms of funding applications to make sure Unseen Heroes organisation can carry on and grow in what they do. So it's having that immediate impact. That's so important if we're going to be engaging with communities, being able to then deliver an outcome, show how we're shifting the dial for them, show how we're getting that support. So when I reflect on my experience with Unseen Heroes and with Compass, that is the most powerful piece of the puzzle, is giving us this embedding the qualitative voice alongside that big quantitative data set, which is amazing. And they're brilliant to work with. I don't want to be a cheerleader here, but as someone who doesn't have a really strong grasp on quantitative data analysis, even that, just really easy to work alongside to tell us the sort of data that would be really helpful to include and put that in just plain English, which I really appreciate. So what you were kind of suggesting there in terms of just making it really easy to read. We can put it in infographics, we can translate it into different languages and just make it really accessible, especially when our population are children. You know, it's important they can understand what we're finding as well. And probably my last point in terms of being able to pinpoint the geographical location of young carers, that sort of thing is so helpful to understand where to target services. So for an organization like Unseen Heroes, this will be no surprise that as a charity, funding is really, really difficult. So with the limited funds you have, where should we go first? Where will we have the greatest impact? And also where funding is by region, it allows us to show that we have a population in that region so that we can go for that funding. So I think those were the key points that I wanted to kind of talk about today in terms of the qualitative and quantitative data, being able to achieve big systems change thanks to that quantitative data set to accompany, and fingers crossed funding applications being successful, which is always the challenge. So yeah, thank you very much for the opportunity to share. It's been a wonderful journey that continues.
Yeah, it's been amazing working with you. And I think what we found and we find throughout is whenever we talk to community groups, the level of information or the insight they give us is always valuable and different from what other stakeholders might tell you. If you talk to policymakers, they have very different ideas.